Good afternoon, everyone. I wanted to share some things with you all today that I've been hearing from my clients. Several of them have received audits or surveys in the last couple of months, and they've been reporting in those things that they maybe received a citation or that they needed to do just a little bit better. I had issued a video a couple of years ago that talked generically about the things you should do when you're getting an audit. But with this, I have a few more specific details that I would like to go into to show you all some of the things that they've been looking for in recent months. So the care plans are still being looked at very closely. One of the things, or both things that they noted, is that you need a start date for the client care. That's the date you admitted the client. And you also need a separate date on that care plan, which says the care plan date. The reason for that would be, say you admitted that client last year in October, and then you went back in February and you did a new care plan. Of course, it would have a new date. And if they look in the file and there's never any update or new care plan, they might assume that that client's status has been the same for all of those 12 months or however long the time is, or that the care plan hasn't been updated. Now, on the supervisory visits, you should be looking at the care plan and notating whether it needs to be updated or not. And that comparison can be made with the care plan date by the surveyor. On the level of assistance, there's only two that should be on the care plan, either limited or extensive. And just for a short review, you all know that this indicates what type of aid you can have working with that client. If they have more than two ADLs that are extensive assistance and they have a cognitive impairment, then they would need to have an aide that's on the registry. So that's the reason they're looking very closely at that as well. Supervisory visits, I just mentioned those. They would like for you to indicate, if you go to visit that client for a supervisory visit, they would like for you to note, is it a companion care client or is it an in-home aide? Or does that client have an in-home aide or a companion? Which type of client or aide do you have working with them? They want to see you indicate that on the supervisory visit. Also, you're supposed to, at least once a year, you're supposed to observe the aide in the home working. So they'd like to know, if you're doing that, what task was that aide doing when you observed them? Were they dressing the client? Were they bathing them? Were they doing housekeeping? What was the task that you observed when you were there in the home? Going to the healthcare personnel registry checks, that still seems to be a challenge for a lot of agencies. Just keep in mind, all caregivers or aides should be checked whether or not they're on the registry. If someone fills out an application with you and they say, I've been doing this work for 20 years, but I've never gotten on the registry. Some of you call it certified, but here in North Carolina, they like to call it on the registry. If they say they're not on the registry, you still need to go to the healthcare personnel registry and check their name and I think the last four digits of their social security number, because if in that period that they've been working in others' homes and working for other agencies, if they have had any complaints or infractions, whether they were substantiated or not, they will be listed there on the healthcare personnel registry. So make sure you check everyone. And keep in mind, if there was a complaint on an aide or any type of complaint in your agency, you need to have a complaint log. That complaint log needs to list all of your complaints and what the resolution was. They are looking at those as well. So keep your complaint log up to date. It's great if you don't have any complaints. That is wonderful. But if you do, put them on the complaint log and keep in mind, if it was a complaint against the care or one of your aides, it may be something that you need to report to the healthcare personnel registry and follow those guidelines. You all should have this in your policies and you should be able to do that. On the skills validations, I know when you all do those and when I did them, I was always teaching as I went along, assessing those skills. If I saw that someone was a little bit weak in a skill, or if there was something they didn't remember, or if I had some updated information, I would do some teaching. So during the skills validations, if you are teaching, you may not have a line item in there that says, I taught this or I taught that. Maybe just at the end, you make a note that says, we went into more detail about a bed bath, or, I did some teaching regarding the proper way to check someone's pulse if you're having your aides do that. Just annotate that there was some teaching going on. And I know you all are doing it. It's very hard to assess those skills and not teach at the same time. One of the other areas that came up is that the quarterly record reviews sometimes were not completed or not documented. Every quarter, there should be a couple of people on your staff that sit down and look through your records to be sure that you're in compliance and that there's not any trends that are coming up that you need to get ahead of. Those need to be documented. It needs to say who conducted that review. And the main thing is it needs to say what is the action plan for making sure that anything that was found is going to be corrected going forward. You should do at least a 10% sample of the clients that you have on your roster. If you have 200 clients, then that would be 20. If you have 20, that would be 2. However, I never did less than 5. So just make sure you do enough so that you can see the trends. Also include active and discharged clients. Pick a few of the discharges because someone may have been discharged and there may have been something in their file that wasn't up to date. And when your surveyor comes, they may want to look at discharge files as well. I am happy to provide this information for you all. I've been talking to my clients and they've been reporting in about the things that they need to do better or that they did well. But I want you all to know before you go into your files or in your agency and you change anything relative to what I have spoken to you about today, please check with the regulatory agency. If there was something that wasn't clear, check with DHSR. If it's related to employment, you go to the Employment Commission. Whatever you need to do before you make a major change, you check with the governing body for that area and make sure that you are making the proper change for your agency.